When it comes to talking about heart health, we often hear statistics connected to men, but doctors say that women need to be thinking about this too.
And that is the mission behind the Hope, Health, and Heart event presented by the Minneapolis Heart Institute Foundation. CEO Kristine Fortman is with us today, along with Dr. Retu Saxena, who is a cardiologist with Allina Health. Ladies, so good to see you. Thanks so much for joining us. Before we get into all the others, the event and everything else and what you're doing, Kristine, tell us about the Minneapolis Heart Institute Foundation and all the good work that you're doing there, because for people who maybe have not heard of it before.
Yeah, well, we're very proud. We've been around for 45 years, and as you know, we're situated right in Medical Alley, so it's so beautiful to be with our industry partners and to have a great institute that values research, which keeps us on the cutting edge of treatment. So we're constantly improving cardiovascular care for everyone, but today we're here to talk about women's heart health.
Yeah, why is that important to keep up that conversation?
Because heart disease is the #1 killer of women in the United States and as well as the world. And again, we have a problem of both kind of sex-specific testing as well as just awareness that heart disease is the #1 killer of women in the United States.
And you're helping people navigate through their own health journeys. Now, I guess, what do you see? How can women take better care of their heart health at home?
Well, I think it's always know your risk factors. If you have a family history or you're concerned about your risk factors, there are current things that you can do to understand your cardiovascular risk, such as getting your cholesterol checked, getting your kind of newer cholesterol things like an apolipoprotein B or an LPA checked, knowing your blood pressure. But one of the things that we utilize as a risk stratifying tool is something called coronary artery calcification, which is a test that you can get out of pocket. It's about I think $100.
$100, yeah.
And that will help us understand if you're already laying down plaque in your heart arteries.
Well, Dr. Saxena, you were telling us before that cardiovascular disease is the leading cause of death for women, but yet it is dramatically underdiagnosed. And why is that?
I think because in general, when women present with heart disease, say a heart attack or symptoms, women still present with chest discomfort. In fact, chest discomfort is still the leading presentation, but it's different than what we think of as the quote-unquote Hollywood heart attack, that crushing chest pain. That's not necessarily how women present with symptoms. Symptoms tend to be more vague, kind of generalized, a lot more shortness of breath or fatigue, which how many of us aren't fatigued on this panel, right? We happen to be women. And so I think that it gets under-evaluated, underdiagnosed, definitely under-researched, we know that. And that's why we miss so many diagnoses.
And you're trying to change that, we should say, because you are trying to push ahead in the research category. The foundation pursuing research related to what you were talking about, this breast arterial calcification.
Right, so we have the Penny Anderson Women's Center for Cardiovascular Health, which allows us to really focus in on research that will make a difference in women's heart health. And Retu is leading as the principal investigator the study you mentioned. I'd love Retu to tell us about it.
If you can tell us.
Yeah, so we know that women of a certain age and above, almost all women in this country have a test called a mammogram looking for breast cancer. Mammogram is widely used. It is sex specific, and that primarily individuals with just breasts get mammograms. Turns out on the mammogram, there's a radiologic finding called breast arterial calcification. And breast arterial calcification, although it's not the same as that calcium score, can be a marker of increased cardiovascular risk.
Are you saying that on the mammogram that's already in there?
It can be read out on the mammogram.
So,
but right now there are no current guidelines in the United States for our radiology colleagues to read it out.
And so you're trying to change that, and that could be a better indicator marker or something?
Well, it would be a sex-specific marker to look for women at risk for cardiovascular disease, to start having the conversation about risk prevention.
So you're looking at calcium, is that what that is?
Looking at calcified arteries in the breast tissue, which is different than calcifications on a mammogram in cancer or nodules. It's actually in the little tiny arteries that feed the breast.
We're learning so much. Okay, and you have an event coming up. Tell us about it. Tuesday, August 11th.
So August 11th, Tuesday, from 5 to 8:30. It's our 10th anniversary of our Hope, Health, and Heart event, where we pull together around 300 plus women, a community of women, to come together to have a fun night out. It's marketplace shopping, great food, good drinks, but then we have cardiologists like Retu and others that have a panel where the audience can ask questions of. So it's very educational and a lot of fun, and it's important for people to feel comfortable to ask questions about their heart health.
If we can quickly just, I want, you know, I think the event's going to be great, but a sign perhaps that something may be worth paying attention to that is related to the heart, that women should, a sign that we should be paying attention to.
Yeah, if you're exercising regularly, you're feeling good, you're living your best life, you know, that's great. If, however, you notice that you say you're exercising regularly and then the last few weeks you feel more short of breath, you're having chest tightness, heaviness, or discomfort that occurs with either physical or emotional stress, you're waking up short of breath at night, can't catch your air, these are things to worry about, regardless of who you are.
Go to your doctor then.
Always good to spread the word on what people should be looking out for. Thank you so much for coming in, ladies.
And good luck with your event.
Thank you.
Thank you.